Hello everyone, this is Dr. Vatsalya from Divineveda. First of all, I would like to thank you all for showering your wonderful support on us in our effort of improving knowledge on the diseases affecting the mankind and how it can be managed through Ayurveda. So today I am here with a joint disorder which majorly affects the women population, that is rheumatoid arthritis. In modern medical science, rheumatoid arthritis is regarded as a progressive autoimmune disorder. That means the immune system, which normally protects and supports our body, starts to attack the normal cells in the body, leading to manifestation of many diseases. Its main characteristic features are joint stiffness, restricted movements, joint pain, and joint swelling or inflammation. This condition is 2.5 times more prevalent in women than men in the middle-aged group. This disease can affect both large joints and small joints, and it usually affects symmetrically. That means if one knee joint is affected, then the other will also be affected. In Ayurveda, different joint disorders are explained, out of which rheumatoid arthritis is in close resemblance with the disorder named as Amavata. The word Amavata consists of two words, Ama meaning raw or undigested and Vata meaning the body constituent. Amavata together means the disease caused due to the combination of vitiated Ama as well as Vata. As per Ayurveda, the equilibrium of body constituents is responsible for health and any derangement in them leads to diseases. The Vata constituent in particular, in its standard functionality, is responsible for the movements of all the body parts, which includes all joints of the body. So in Amavata, due to derangement of this Vata along with the Ama leads to Amavata. Now let's see what are the causative factors leading to Amavata. In Ayurveda, the key reason for the manifestation of any disease is considered to be the derangement of or low digestive power, also called as Agni. The causative factor for the manifestation of Amavata is also said to be the low digestive power. This low digestive power can happen due to two main reasons. The first one is the dietetic habits of a person, and the second is indulging in certain lifestyle practices which leads to Amavata. Now let's get to know these causes better with few examples. Under dietetic practices, the practice of having incompatible foods, excessive unctuous food, junk foods, stale foods, fatty foods such as curds and black grams, drinking of impure or contaminated water, etc. are included. Now let's see what are incompatible foods. The word incompatibility can be understood as two substances being so different that mixing these substances will lead to some harmful effects on the body. For example, the mixing of honey and ghee in equal quantity is said to be harmful to the human body. Similarly, the intake of fish and milk or processing milk with any of the source substances is considered incompatible. The harm, though may not be seen as an immediate effect after the intake of incompatible foods, but can act as a slow poison in the body and lead to the manifestation of many diseases slowly in the body. In Ayurveda, particular incompatible food substances are explained which causes many diseases. Here is a list of incompatible foods that are explained in Ayurveda. Now let's move on to incompatible physical activities. These include excessive physical exertion or complete absence of exercise, sedentary lifestyle, day sleeping, waking for long hours at night, controlling the natural urges, and intake of cold items immediately after the exposure to hot weather, and vice versa. The causative factor of rheumatoid arthritis in the modern medical system is said to be unknown. It is still considered an autoimmune disorder with risk factors including genetic factors and environmental factors. A person having rheumatoid arthritis in the family history stands to get rheumatoid arthritis at 3 to 5 folds more than the person without a family history. Environmental factors such as smoking and alcohol consumption are said to elevate the risk of getting rheumatoid arthritis 3 times more in people with a positive Ra factor than in people with a negative Ra factor. Now that we have understood the causative factors of rheumatoid arthritis, let's see what are its symptoms. Rheumatoid arthritis can show symptoms in two phases, acute and chronic phase. Symptoms in acute or initial phase are large joint involvement, swelling or inflammation of the joint, severe pain in the joints, weakness with weight loss, lethargy or feeling of heaviness, morning stiffness in the joints, muscle wasting, and low-grade fever. The symptoms included in the chronic phase are joint deformity, particularly the swan neck deformity, spindle-shaped small joints, spindle-shaped fingers, ankylosis, ulnar deviation, contractures, and flexion deformity. At the end, let us understand what are the complications of rheumatoid arthritis. If in the chronic stage, the disease is left untreated or neglected or improperly treated, it may involve systemic organs and cause complications. These include permanent deformity of the joint involved, restricted movements of the joint, cardiac involvement, disturbed sleep due to pain and discomfort, and also depression. Now that we have understood the causes, symptoms, and complications of rheumatoid arthritis, in the upcoming video, we'll be discussing about the Ayurveda treatment explained for rheumatoid arthritis, as well as some of the yoga postures which help in the joint movements and also relieving the pain. Till then, stay tuned and do watch our other videos on different diseases given in the description box. If you like this video, do give it a thumbs up and share it with your friends and family. You can also leave a comment below on other diseases which you would like us to work on. Until next time, take care and thank you for watching this video.